How does palliative care relate to hospice ethics? Have you ever wondered how palliative care and hospice ethics connect in the world of healthcare? Let's break it down in a way that makes it easy to understand. Both palliative care and hospice care share a commitment to improving the quality of life for patients, especially at the end of life. They focus on addressing not just physical pain but also emotional, social, and spiritual suffering. Palliative care is a broad approach that can be provided alongside treatments aimed at curing an illness or as the main focus when those treatments are no longer effective. It is built on key ethical principles. One of these principles is autonomy, which means respecting patients' rights to make informed decisions about their care. Another principle is beneficence, which is all about acting in the best interest of the patient. Nonmaleficence is also important, as it emphasizes avoiding harm. Lastly, justice ensures that everyone has fair access to care. Hospice care, on the other hand, is a specialized form of palliative care. It is typically provided in the final months of life, when curative treatments are not pursued anymore. Hospice ethics also emphasize the same principles but focus more on comfort and dignity during the dying process. This means respecting the preferences of both patients and their families while ensuring informed consent and providing care that addresses emotional and spiritual needs. Relational ethics play a big role in both palliative and hospice care. This approach highlights the importance of relationships among patients, families, and healthcare providers. Mutual respect, trust, and shared decision-making are essential for delivering ethical care. It also takes into account the social factors that influence patient choices and access to care, promoting fairness and individualized support. Practical applications of these ethical principles in hospice and palliative care include comprehensive symptom management. This means alleviating pain and distress without hastening death, which aligns with the principle of nonmaleficence. Supporting patient autonomy is also vital. This involves including patients and families in care planning and respecting their cultural and spiritual beliefs. Ensuring justice is another key aspect. Advocating for equitable access to palliative and hospice services across different populations is essential. Interdisciplinary teamwork is important too. This means addressing the complex needs of patients by integrating medical, psychological, social, and spiritual care. Healthcare providers must engage in continuous ethical reflection and education. This helps them navigate dilemmas such as when to initiate or stop life-sustaining treatments. Balancing hope with realistic outcomes is also part of this process. In essence, palliative care and hospice ethics are closely linked through their foundation in core medical ethics principles. They prioritize relieving suffering, respecting autonomy, and promoting dignity at the end of life. While hospice care focuses specifically on the terminal phase, palliative care encompasses a broader scope throughout serious illness, both requiring sensitivity to patients' values and relationships to provide compassionate, patient-centered care.